Hi, I'm Dr. Janet Pope here at Room Now. I'm at the ACR22 Convergence live from Philadelphia. I wanted to talk about breaking bones and low-dose glucocorticoids in our patients with rheumatic diseases. So this was a late-breaking L01. And this was a study of multiple patients with rheumatic diseases on glucocorticoids or not. And it actually found things that we already know, such as glucocorticoid-induced steroids, higher dose, more risk of fracture. We already know that. But it was a late breaker because there's some innuendos here that are really important. So the first thing that's important is even at 2.5 milligrams a day, there was more bone loss and there was an increased risk of fractures. The next thing is, it wasn't just where you got on your bone density, it was the change from your baseline. And that makes sense. If you're losing more bone mass, you're going to have more potential fractures. And the take home could be basically interpreted one of two ways. One way you could say the take home is any dose of glucocorticoids isn't great. Follow the BMD and treat them accordingly, because treatment could, with bisphosphonates or denosumab, etc., could help reverse the findings, of course, because steroid-induced osteoporosis is treatable often. But the other take home could be that there's an interaction of rheumatic diseases that are chronic and inflammatory, and in and of themselves can increase the predilection for low bone density, so that 2.5 milligrams of prednisone in a chronic rheumatic disease patient maybe is equivalent in the general population to 5 or 7.5 milligrams because they have this added risk. I'm speculating, but that did come up in the questions as well. So I think it's giving me a new respect for looking at the bone density of my patients, even on low-dose glucocorticoids. Enjoy the rest of the meeting. Thanks.